ஹலோ கைஸ், எல்லாருக்கும் வணக்கம். இன்றைக்கி வந்து பார்த்தீங்கன்னா MRB Q&A செக்ஷன் தான் பார்க்க போகிறோம். MRB கொஷின்ஸ்லேருந்து ஒரு 20 கொஷின்ஸ் ஷேர் பண்ணியிருக்கேன். ஆல்ரெடி 20 கொஷின்ஸ் வந்து நம்ம சேனலில் வீடியோ போட்டிருக்கேன். வீடியோட லிங்க் டிஸ்கிரிப்ஷனில் இருக்குது. நெக்ஸ்ட்டு 20 கொஷின்ஸ் இந்த வீடியோவில் பார்க்கலாம். Question number 21. The most common pathogenic mechanism of acute pancreatitis is dash. Option A, lack of enzyme secretion. Option B, overproduction of enzyme. Option C, bacterial infection. Option D, autodigestion of the pancreas. The answer is option D, autodigestion of the pancreas. Question number 22. What does the nurse monitor for in a patient with acute renal failure? Option A, hypernatremia and CNS depression. Option B, pulmonary edema and ECG changes. Option C, Kushmal respiration and hypotension. Option D, urine with high specific gravity. The answer is option B, pulmonary edema and ECG changes. Question number 23. A disease caused by Treponema pallidum is dash. Option A, scabies. Option B, syphilis. Option C, hepatitis A. Option D, leprosy. The answer is option B, syphilis. Question number 24. Which of the following is an important nursing intervention for a patient with Cushing syndrome? Option A, restrict the protein intake. Option B, observe for hypotension. Option C, protect from infection. Option D, restrict the carbohydrate intake. The answer is option C, protect from infection. Question number 25. Involvement of which of the following structures will lead to right side hemiplegia and apexia? Option A, left middle cerebral artery. Option B, vertebral artery. Option C, brain stem. Option D, right middle cerebral artery. The answer is option A, left middle cerebral artery. Question number 26. Which one of the following is a common response expected in a patient with stroke to the changes in body and image? Option A, denial. Option B, disassociation. Option C, delusion. Option D, depression. The answer is option D, depression. Question number 27. A patient with yearly osteoporosis must be advised to option A, lose the weight. Option B, start exercise. Option C, eat high protein diet. Option D, stop smoking. The answer is option D, stop smoking. Question number 28. For doing an nasotracheal suctioning, during which of the following patient activities the catheter should be inserted? Option A, swallowing. Option B, inhaling. Option C, exhaling. Option D, retching. The answer is option B, inhaling. Next, question number 29. The simple most effective method for reduce the risk of stasis of pulmonary secretion is dash. Option A, antibiotics. Option B, chest physiotherapy. Option C, 2 hourly position changes. Option D, oxygen administration. The answer is option C, 2 hourly position change. Question number 30. What is cyanosis? Option A, bluish discoloration of the skin. Option B, reduce the oxygen in blood. The answer is option A, blue discoloration of the skin. Question number 31. The period from conception to birth is denoted as dash. Option A, infancy. Option B, germinal. Option C, embryonic. Option D, prenatal. The answer is option D, prenatal. Question number 32. Role of nurse is having a charge of somebody's health whose vision is this. Option A, Virginia Henderson. Option B, Florence Nightingale. Option C, Mildred Montague. Option D, Esther Brown. The answer is option B, Florence Nightingale. Question number 33. Which of the following developmental stage correspond to infancy? Option A, trust and mistrust. Option B, autonomy and shame. Option C, initiative and guilt. Option D, industry versus inferiority. The answer is option A, trust versus mistrust. Question number 34. Who's proposed the nursing theory of self-care deficit? Option A, Watson. Option D, Dorothea Orem. Option C, Rocher. Option D, Nightingale. The answer is option B, Dorothea Orem. Question number 35. The head circumference of the normal infant is option A, 28 to 30 centimeter. Option B, 33 to 35 centimeter. Option C, 36 to 38 centimeter. Option D, 38 to 40 centimeter. The answer is option B, 33 to 35 centimeter. Question number 36. The leading causes of death in adolescent is dash. Option A, homicides. Option B, hepatitis A. Option C, accident. Option D, malnutrition. The answer is option C, accident. Question number 37. The legal definition of death that facilitate organ donation is cessation of dash. Option A, function of brain. Option B, respiration. Option C, pulse. Option D, blood pressure. The answer is option A, function of brain. Question number 38. The body temperature at which tissues and cells can best function is dash. Option A, 32 to 34 degrees Celsius. Option B, 34 to 36 degrees Celsius. Option C, 36 to 38 degrees Celsius. Option D, 38 to 40 degrees Celsius. The answer is option C, 36 to 38 degrees Celsius. Question number 39. Man having a high basal metabolic rate because their body contains more dash. Option A, estrogen. Option B, progesterone. Option C, calcitonin. Option D, testosterone. The answer is option D, testosterone. Question number 40. The mechanism by which the body loses the heat to the environment without having contact is dash. Option A, evaporation. Option B, convection. Option D, radiation. Option D, conduction. The answer is option C, radiation.